Components: cerebrum, cerebellum, brainstem, spinal cord. Shows grey matter and white matter. Grey matter, collection of neurons, body and neuroglial cells. White matter, collection of bundles of nerve fibers, mainly axons. Nuclei, scattered masses of grey matter in the substance of white matter. Nuclei. Now, central nervous system covered by three protective coatings: dura matter, arachnoid matter and pia matter. See, this is the foundation. You must know the whole, the brain and the spinal cord. And knowing the cells, their orientation, their function, where the axons are there, where the nuclei are there, and it will make easier for understanding. Now, spinal cord. See, this is important. Draw a well-leveled diagram, histology of the spinal cord. Long cylindrical mass gives rise to 31 pairs of spinal nerves. Length 45 centimeters to 18 inches. Extend from upper border of the atlas vertebra to lower border of the first lumbar vertebra or upper border of the second lumbar vertebra in adults. Yesterday, the batch went for practicals. They had the histology slides of your thyroid and adrenal gland. And also I gave the specimens of the brain and the spinal cord. Just to have a glimpse, you have to see what is exactly the structure is. Now, see, this will be a 4 marks question. Now, see, this is the ventral median fissure, the dorsal median septum, posterior funiculus, lateral funiculus, dorsal grey horn, the lateral grey horn, and anterior grey horn, the anterior funiculus. Now, it's a simple drawing and you have to label them. Spinal cord has deep anterior median fissure, deep anterior median fissure, dorsal median fissure, ventrolateral and dorsolateral sulci, and ventral motor roots of spinal nerves, dorsal sensory root of spinal nerves, ventral motor roots of spinal nerves, and dorsal sensory roots of spinal nerves. This is the dorsal grey horn, dorsal median septum, posterior funiculus, lateral funiculus, anterior funiculus, anterior horn, grey horn, lateral grey horn, ventral median fissure. Now, spinal cord, conus medullaris, lowest part of the spinal cord is conical, and phylum terminally, modification of pia matter, fibrous band, continuation of conus medullaris. Now, the section of the spinal cord, histology of the spinal cord, section of spinal cord shows central canal. We have beautiful slides in the histology lab. You ask Avinash, he will show you. Okay? At least see it, because any batch might be given the spinal cord. One batch will be given cerebellum or cerebrum. At least know the cell types and how you any question is there, you have to just answer. Central canal, anterior horn, posterior horn, like this. Okay? Now, section of spinal cord shows central canal lined by Ependyma, The ependyma consists of ciliated columnar epithelium. Central canal has surrounding grey matter and further outside white matter. This is lateral grey horn, this is the dorsal grey horn, anterior grey horn, the ventral median fissure, anterior funiculus, ventrolateral sulcus, lateral sulcus, dorsolateral sulcus, posterior funiculus, and dorsal median septum. Now you see, it's a photomicrograph of histology of spinal cord, low magnification, H&E stain, anterior horn cells, high magnification. See, in the anterior grey horn, you see the multipolar anterior horn cell. This you will see in our histology lab, because we don't have special stains. Slides, posterior white column, the median septum, central canal, ventral median fissure, anterior column. Grey matter in the form of alphabet H. Alphabet H has anterior and posterior grey horns. Anterior grey horn consists of large multipolar neurons called the anterior horn cells. This is the anterior horn cells. This multipolar anterior horn cells. Now, I have large vesicular nuclei, prominent nucleolus, numerous cytoplasmic nasal granules, actions of the anterior horn cells form of ventral root of spinal nerves. Neurons of posterior grey horn are smaller in size. Grey matter also contains many microglia and blood vessels. White matter, now see, white matter consists of nerve fibers and neuroglial cells. Nerve fibers covered by myelin sheath, a layer of fine connective tissue called epineurium. That's the epineurium. Now, see the spinal cord as such. The tracks, which I told you the other day. So, white matter divided into posterior, lateral, anterior funiculus. H&E staining myelin is removed during tissue processing. Hence, axons are surrounded by a clear space. These spaces. This is the space. This is the space. Only the nuclei are visible. White matter divided into posterior, lateral, and anterior funiculus. Pia matter, spinal cord is surrounded by a pale staining fibrous material called pia matter. Okay. Now, clinical correlation. Multiple sclerosis. In multiple sclerosis, myelinated nerves, fibers of the brain and spinal cord are progressively damaged. In clinical correlation, multiple sclerosis. In multiple sclerosis, myelinated nerve fibers of brain and spinal cord are progressively damaged. Occurs because of damage to myelin, may result in blindness, muscle weakness, loss of sensation, and so on. Cause is unknown, may be an autoimmune disorder. Spinal cord, the central canal is lined by tall columnar ependymal cells, ventral median fissure, dorsal median septum, covered by pia matter, arrangement matter, and dura matter. Grey matter, H-shaped anterior horn cells, large multipolar neurons, few neuroglia, posterior horn, and small neurons. White matter, 3 columns, anterior, lateral, posterior. Myelinated nerves, fibers, neuroglia. Now, spinal cord summary. This is an examination guide. consists of outer grey matter, inner white matter and central Ependyma lined central canal. Grey matter has anterior horn, shows large multipolar and anterior horn cells. Posterior horn shows small neurons. Grey matter also has neuroglial cells. White matter consists of posterolateral and antero-white columns. These columns have myelinated axons that are surrounded by neuroglial cells, having deep ventral fissure and dorsal median septum. Dorsal median septum. Yeah, this is ventral median fissure. This is anterior funiculus. The ventrolateral sulcus here. Now levels of spinal cord section. Now segments, levels of the spinal cord section. Segment cervical, large and oval. Reticular formation, long and slender, this broad and massive anterior horn, broad and massive anterior horn. Thoracic, small and circular, slender posterior horn, lateral horn and slender anterior horn. Lumbar, large and circular, bulbous and short posterior horn, bulbous and short anterior horn. Now sacral, small and circular or quadrilateral, this massive and ovoid anterior horn cells, massive and ovoid posterior horn cells. Now please see in your books and you have to correlate. You draw the diagram at this level, cervical level, this section of the spinal cord at cervical level. It will show you this picture. Thoracic level, this picture. Lumbar level, large and circular. So it's more or less circular. This is oval. This is small and circular. This is large and circular. Small and circular or quadrilateral. See? The cervical, thoracic, lumbar and sacral. Now features, cervical, thoracic, lumbar and sacral, outline of section, oval, oval to circular, nearly circular, circular, grey matter, posterior horn, large, slender, cervical region, large, slender extent, far posteriorly massive, lateral horn massive, anterior horn absent, small, slender and lateral horn slender, anterior horn present, oval to circular, thoracic level. Now, nearly circular, large, bulbous, and bulbous present only in lumbar 1 and lumbar 2, L2 segments. Massive present in S2, S3, 4 segments. Now, reticular formation, cervical is well developed, poorly developed in thoracic, absent in lumbar and absent in sacral. Amount of white matter, massive, 4+, large, less than in cervical region, +3, less, slightly less than in the thoracic region, 3, and very less in the sacrum. Posterior intermediate sulcus present throughout, present in upper 7 thoracic segments. Now, absent in the lumbar, absent in the sacrum. Now, cerebellum. See, draw a well-labeled diagram of histology of cerebellum, highly folded to accommodate millions of neurons in a small area. Folding is called Arbor Vitae. Cerebellum has 2 cerebellar hemispheres that are connected to each other by a median vermis, divided into number of lobules by fissures. You can see, please see this specimen, please see this specimen. It is there in our lab. And you see this is cerebellar cortex, this is cerebellar cortex and this is cerebellar peduncle. And this is nucleus globulus, nucleus fastigius, nucleus emboliformis, nucleus dentus. This part. Now this is the vermis, this is the white matter, this is the grey matter. Histology of the cerebrum structure is uniform throughout, homotypical. Structure of uniform throughout, homotypical. Has outer cortex, grey matter. This is the grey matter. And your inner white matter. The cerebellar pattern, it fascinates me. And it is designed in such a way that all information and everything is of the brain, and it has numerous activities. I showed you that if anything goes wrong, shown you the clinical pictures. So you see the design and the position of the nucleus. Now, 4 nuclei, nucleus dentus and nucleus globulus, nucleus fastigius, nucleus emboliformis, nucleus dentus. Nuclei emboliformis and nucleus fastigius. Now, these can come as a short note. The nuclei of the cerebellum. Now, you see histology of the cerebellum. Cerebellar cortex shows 3 layers. The outer, this is grey matter, molecular layer, Purkinje cell layer, granular cell layer. The cerebellar cortex shows 3 layers, outer molecular, middle Purkinje cell layer, and inner granular layer. Please see it in the histology section of the slide, histology slide in the lab. Now this pattern, molecular layer, lies just deep to the pia mater, lightly stained layer with hematoxin and eosin stain. Cells, stellate cells in superficial part and few basket cells in the deeper part. Fibers, numerous branching process of Purkinje cells, axons of granule cells and climbing fibers. See now, this is the granule cell, this is the basket cells. This is the Purkinje cell, this is the Purkinje cell, this is the Purkinje cell, this is the Purkinje cell. And you can see the white matter, the granular layer, Purkinje layer, and your molecular layer. Now, molecular layer lies just deep to the pia mater, lightly stained layer with hematoxin and eosin stain. Cells, stellate cells in superficial part and few basket cells in the deeper part. Fibers, numerous branching processes of Purkinje cells, axons of granules and climbing fibers. Purkinje cell layer, single row of Purkinje cell bodies that are arranged between molecular and granular layer. Now, this is the Purkinje cells. This is the molecular layer and this is the Purkinje layer. Here, basket cells. Now, dendrites of Purkinje cells arise from the apex of the flask and enter into the molecular layer. This is the molecular layer, the branching. Here the flash shape is branching. That is towards the pia mater. Okay, molecular layer. Now, dendrites of Purkinje cells rise from the apex of the flask and enter into the molecular layer. Single axon arises from the base that passes through the granular layer and white matter to the cerebellar nuclei. This is the white matter. This is the granular layer. Now, these are traveling here. These are climbing fibers in yellow. Mossy fibers in green. But we are having H&E stain, no special stain. But this is a diagrammatic representation. Even green stain is not seen. But there are special stains. You please look into the histological pictures in the lab with special stains. There are around 10, 15 pictures. You see on the left side, as you enter the lab, it's in the left side, in the wall, left wall. Granular layer lies between Purkinje cell layer and white matter, stains dark with hematoxylin because of closely packed numerous small granules. These Purkinje cells, The cells, granule cells and Golgi cells. Granule cells, small neurons with rounded nucleus. Golgi cells are large stellate cells. Granular layer fibers. Granule cells has mossy fibers. These are mossy fibers that brings information from pons to granular cell, pontocerebellar fibers that brings information. Granule cells, mossy fibers that brings information from pons to granule cells, pontocerebellar fibers. Climbing fibers and axons of Purkinje cell passes through the granular layer. This granular layer. Now, glomeruli, see the action of the Golgi cells, dendrite of the granular cells, rosette. This is the capsule, dendrite of Golgi cell, mossy fibers. This. The mossy fibers are as dilated terminal. This dilated terminal is surrounded by dendrites of granule cells, axons of Golgi cells. Mossy fibers terminal with surrounding dendrites and axons from light stained areas to granular layer. These areas are called glomeruli of cerebellum. Now, mossy fibers, glomeruli of cerebellum, this can come as a short note, and also don't mix up with the glomeruli of the kidney. A glomeruli, you see glomeruli, you start writing kidney. You read the question. Now, gray matter, see, molecular layer, Purkinje layer, granular layer, white matter, is the Purkinje cells here. You can see in our histology lab. Now, histology of the cerebellum, photomicrograph for histology of cerebellum, low magnification. This is the molecular layer, Purkinje cell layer, granular layer, grey matter, dendrites, you will see typical molecular layer, Purkinje cells and granular cells. Cerebellum, histology of cerebellum, again outer grey matter, cortex, inner white matter, fibers and nuclei. Molecular layer, outermost layer cells, stellate cells, basket cells, fibers, dendrites of Purkinje cells, climbing fibers and parallel fibers. Purkinje cell layer is middle layer, single row of flask-shaped cells, Purkinje cells. Granular layer, deeper layer cells, granule cells, Golgi fibers, mossy fibers, glomeruli. Now, glomerulus enlarged terminal of mossy fibers plus dendrites of granule cells and axons of Golgi cells. This I just want to you because the word is similar. You take your histology book or your textbook, see the components of kidneys, glomeruli, Bowman's capsule is the landmark. But where is the glomeruli and cerebellum? It's quite different. Hell and heaven. So, just glomeruli dekh MCQ or a short note, you start writing. You just see, and today only you just compare. Now, apparent fibers of cerebellum, the axons of Golgi body, this is a rosette capsule, mossy fibers, dendrites of Golgi. Now, climbing fibers, olivocerebellar fibers arising from inferior olivular nucleus. Synapses in molecular layer with Purkinje cells. One fiber for one cell. Mossy fibers, other than olivocerebellar fibers, they includes vestibular cerebellar, pontocerebellar, and spinocerebellar fibers. The name suggests that vestibulocerebellar, pontocerebellar, pontine nucleus, and spinocerebellar fibers. Mossy fibers have dilated terminal in granular layer. They synapse with dendrites of granule cells, axons of Golgi cells. This synapse forms light staining cerebellar glomeruli. Even in the histology section, if on day one, the students who are attending, one slide, say, I'm just saying that one slide on cerebellum, one slide on kidney. Out of 5 slides, they have given it. Then liver or spleen or your ovary. Now, you have to distinguish. Simple, 2, 3 features of a slide. Key features. But today you compare it and distinguish that. Then this will be our revision. Now, see, this figure is very common. It has been repeating in the thing. This lecture has a repetition of many things. तो एक बार सुन लिया हो ठीक है हम देख लेंगे. No, don't be casual because this is you take it as a revision and also your study. And see cerebellum, summary examination guide. Outer cortex, grey matter and inner white matter. Grey matter, 3 layers, outer molecular, middle Purkinje cell layer and inner granular layer. Molecular layer, lighter on HN stain. It has numerous nerve fibers, stellate cells, basket cells and neuroglial cells. Purkinje cell layer consists of single row of flask-shaped Purkinje cells. Granular layer is dark on HN stain and has numerous small granule cells, large Golgi cells. White matter is composed of fibers and neuroglial cells. Now, cerebrum. See, this is every book has this picture 1, 2, 3, 4, 5, 6 white matter here. This is the pia matter, blood vessel. And this is the small pyramidal cells, medium pyramidal cells, granular cells, large pyramidal cells, bundle of axons. Now, Draw a well-labeled diagram of histology of cerebral cortex. Outer grey matter and inner white matter. Grey matter of cerebellum called cerebral cortex. The grey matter consists of numerous cells, bodies of neurons, neuroglia, processes of neurons and neuroglia and blood vessels. Grey matter has numerous synapses between neuronal processes. In the cerebral cortex, neurons are arranged in 6 layers. 1, 2, 3, 4, 5, 6. Please, if you can download Gray's anatomy. Gray's anatomy picture, they বলে না অসাধারণ. You study from your text, Vishram Singh or Samar Mitra, your Ashim Datta, your Chaurasia, and Indervir Singh. Now, cells of cerebral cortex, each horizontal cell of casual, yeah. 1, 2, 3, 4, 5, 6, white matter. Now, you see these horizontal cells as horizontal cells of casual. 2 granular cells, your stellate cells, here, and your basket cells, fusiform cells, cells of Matoni, Matonti, not Meloni, President of Italy. Okay. Now you today draw all pictures and you just label them. Pyramidal cells, about 2/3 of the cortical neurons are pyramidal cells, multipolar neurons, triangular in shape, and apex of the triangle is directed towards the surface of the cerebral cortex and have apical dendrites. This is apical dendrites. Apex and rises from the apex and extends towards the surface of the cerebrum. Basal dendrites are from basal angles of the cells. Axon arises from the base of the pyramidal cells. Now, layer of cerebral cortex. Neurons of the cerebral cortex are arranged in 6 layers. The molecular layer or plexiform layer, external granular layer, pyramidal cell layer, internal granular layer, ganglionic cell layer, and multiform layer. Molecular or plexiform layer just beneath the pia mater consists of predominantly fibers of neuroglial cells, neurological cells, has few horizontal cells of kajal. Kajal, not the Lakme kajal. It's a stain. You will see that picture in the lab. That's a special stain. So, 2 types of neurons, small pyramidal cells and stellate granular cells. External pyramidal layer, layer of medium pyramidal cells, has medium pyramidal cells, few stellate cells and cells of Martinotti. Internal granular layer consists of closely padded numerous small granular stellate cells. Has horizontal fibers and called external band of bell larger. Internal pyramidal cells consist of large pyramidal cells in the motor area of the cerebrum. These cells are very big and they form large pyramidal cells of Betz. Also contains horizontal fibers that forms internal band of Belliger. Along with Betz cells, the layers has few cells of Martinotti, fusiform cells and granular cells. Multiform layer, layer of polymorphic fusiform cells has spindle-shaped fusiform cells, fused stellate cells and multinucleate cells. Fusiform cells lie perpendicular to the surface with axons coming out from the center of the cell and dendrites from both ends. White matter, deep to the sixth layer, white matter of cerebral cortex is present, consists of small rounded nuclei or neuroglial cells and numerous nerve cell processes. Here, this is a HN sting. External molecular layer, external granular layer, external pyramidal layer, internal granular layer, ganglionic layer, multiform layer. Here, small pyramidal cells, large pyramidal cells. This is the pi matter. Now, cerebral cortex or grey matter is the molecular layer, neuroglia, horizontal cells of Kajal. External, this is a revision. Now, external granular layer, small pyramidal cells and granule cells. External pyramidal layer, medium pyramidal cells, few stellate cells and cells of Martinotti. Fourth, internal granular layer, small granule cells, external band of Pelligra, ganglionic layer, large pyramidal Betz cells, internal band of Pelligra, multiform layer, fusiform cells. So, I had opened the window of the nervous system with the quotation of Shakespeare, and now you dive, not drive, you dive in the ocean and you have to swim, and definitely you people are great because attendance is there, but you have to put 2.5 months effort, then you will fly with your wings. But not a single day should be lost.